Hi, my name is Dr. Marissa Greif Hackett, and I'd like to tell you about our experience supporting youth who are LGBTQ+ in the Broward County Child Welfare System, drawing on highlights from our recently published article in the CWLA. I work for the Children's Services Council of Broward County, or the CSC, which funds programs to help young people reach their full potential by creating a safer and supportive community in which to develop and grow. We know that for youth who are LGBTQ+, finding such positive support can be challenging, and without it, they may experience devastating life outcomes. Youth who are LGBTQ+ and in the child welfare system are especially vulnerable, with disproportionately higher rates of behavioral health difficulties, contacts with the juvenile justice system, and other experiences of victimization. In order to learn better ways to support youth who are LGBTQ in our community, local youth-serving partners in the Broward Children's Strategic Plan wanted to collect data on the sexual orientation, gender identity, and expression, or SOGI, of youth, beginning with those served in the CSC's funded life coach programs. This information is vital for tailoring coaching and services for the unique concerns of young people who are LGBTQ+. This could run the gamut from finding mentors in the community, advocating for young people in schools, finding peer youth groups for social and emotional well-being, and linking youth to medical and behavioral health services. So, we set out in 2015 to design a relatively simple survey to collect SOGI data. After several iterations with adults learning from youth about acceptable language and wording of questions, we landed on a 6-item survey that asked about youth's currently identified gender, sex assigned at birth, clothing preferences, pronouns, sexual attraction, and sexual orientation. Prior to launching the survey with youth, we provided extensive training with staff about asking these questions, supporting youth, and mitigating bias. Through a one-on-one approach like this, we were aiming to build a strong relationship for trust and a safe space to disclose. We also wanted to gain a commitment from providers to create an environment of inclusion for all youth. We hope to provide avenues for all young people, including heterosexual cisgender youth, to talk more openly about their gender identity and sexuality, and to know that all individuals have a SOGI. So, what did we find? In analyses we presented last year, we were able to see the patterns and prevalences of SOGI in our life coach program. In terms of sexual orientation, we found that 18% of respondents identified as LGBTQ. This varied a little by race, with a rate of 12% for Black youth, 40% for white youth, and 24% for multiracial youth. We also found that about 4% of our young people identified as transgender male or female. In terms of expression, the majority of cisgender and transgender males reported preferring typically male clothing, whereas cisgender and transgender females reported somewhat more flexibility in clothing choices. The majority of transgender youth reported a preference for a particular pronoun, and actually, cisgender youth also reported preferences for the use of particular pronouns. In terms of attraction, about 5% of cisgender individuals reported attraction to the same gender. 3/4 of cisgender females and the majority of cisgender males reported attraction to the opposite gender. 14% of cisgender females reported attraction to both genders, whereas 3% of cisgender males reported attraction to both genders. We continue to collect these data regularly, and our next big task is to update our questions to reflect new and relevant language that youth communities use to talk about SOGI. Thanks for listening.